Say a warm welcome to everybody who's joined us this morning, and I can't believe it's already day 3 of our annual summit, Festival of Ideas. For those of you who don't know me, my name is Jeremy Porteus. I'm the founder and the chief exec of the Housing Learning Improvement Network, or familiarly known as the Housing LIN. And our team have pulled together a really thought-provoking session for you today, but also actually all week we've had a variety of themes, and we continue to do so for the rest of this week, putting together over 40 expert speakers who've given up their time to share ideas, knowledge and expertise to help inform and improve all our sector learning and understanding. Indeed, over 600 people have registered to join us all week, and we anticipate to attract at least 2,500 live streams, which I think is a record for us. And as Sally's just mentioned, please do use social media. There is a Twitter handle and a hashtag HLIN Summit 24. So if anything grabs your attention, grabs your imagination, you want to share, please use that as we go along. And if you'd like some further details about all our summit speakers, and particularly for this session, please use our microsite on our website. For those of you who've been part of the Housing LIN sort of conference seasons for many years, this is our fourth virtual event, but 12th conference overall. And formerly, we were responsible for the Department of Health's capital programme for extra care and housing with care. And our networked approach sort of supports policy implementation, testing out new models of care, research into housing and support. And over the last decade or so, we've continued to be at the forefront of knowledge transfer to influence both strategic thinking and bringing together a range of policymakers and practitioners and researchers to test out and inform operational delivery across specialist and supported housing. And this session today, Advancing Equality and Diversity, is no exception. But before I commence with this session, a couple of other things. First of all, our summit would not be made possible without the support of our headline and associate sponsors listed on this slide. We really appreciate their thanks, and personally I thank them for their support, not just for this summit, but their funding and support enable us to maintain all our events for free during the course of the year. So if you're a first-time member of the Housing LIN, do sign up to receive further updates about our popular Happy Hour series and other news and events that we run right throughout the year. Now, turning to this programme, we've got an action-packed agenda on advancing quality, diversity and inclusion in housing for older adults. It's a theme that's already raised its head on several of the other sessions we've held this week. And we've got a stellar lineup for you who are going to be talking in pairs around particular themes around EDI. But before I hand over to Ian, I just wanted to draw your attention to some sad news. In that many of you will be familiar with the work of Wendy Mitchell, who lived with dementia and championed and advocated it. She died last week, and we were really saddened to hear about this, and just wanted to commemorate her. And of course, we have aspects around dementia today. But she wrote a blog, and what was really lovely about it, she said dementia didn't beat her, and she was a great advocate and drew attention to her own experiences at things like our all-party parliamentary group inquiry on housing dementia. And I'm sure Teresa and Julie will draw reference to that piece of work when they speak. But to kick off, I'm going to hand over to Ian and Tahir from Housing 21, and they're going to share their work and experiences across their agency. We'll then be followed by Manik and Bashir about the Amar Bari, Amar Jibon project with the Bangla Housing Association and the Open University. And we'll conclude with a really fascinating piece of work that's just drawn to a conclusion from the University of Worcester and some funded work from the NIHR, the DemECH project. Some of you will be familiar with that, but some exciting new stuff that's just come out, and we're taking the opportunity to put the spotlight on them, on Manik and Bashir, and to start off with Ian and Tahir. Ian, over to you.
Thank you very much, Jeremy, and good morning, everybody. I'll kickstart with the first perilous task of sharing my screen and hopefully make sure that the technology is working fine. Make sure, there we go. So thank you to Housing LIN for the opportunity to speak this morning. I'm Ian Hodson, I'm Director of People and Culture at Housing 21. And before we hear from the Open University and the University of Worcester about some of their exciting research projects, my colleague Tahir and I are going to provide a short operational and practical update on why these pieces of work are so important to us in then shaping our future of what happens in workplaces through our approaches that we've been taking at Housing 21. There we go. So the slides are moving on, which is always good. So first of all, Housing 21 and who are we? So we've got around 23,000 properties operating with 240 local authorities, and we provide around 48,000 hours of care each week. And 2024 is a really big year for us as we're going to be celebrating our 60th anniversary. Our people and culture strategies based on building on Housing 21's reputation as a great place of work, and we've positioned ourselves in a way, in the best way we possibly can to support this. So we've moved away from the terminology such as human resources to using the term for our function of people and culture, because we don't see people in the same way as being a resource that is almost an asset like a table or a computer by the company. So that terminology is very important for us in terms of how we use it. We take an approach where we look to treat employees as customers of the organization and aspire to provide an employee experience which mirrors that we expect really as consumers when we're out living our everyday lives. We underpin all of our activities with education and facilitative tools, such as the technologies, to create a much more self-sufficient and less paternalistic culture at Housing 21. And for us, it's all about really empowering individuals and embracing the cultures in which we operate. So our respect and inclusion strategy itself is deliberately developed with respect as the lead component rather than equality, as we see this as a much more inclusive approach to how we term our pieces of work, and that terminology seems to sit very well with our residents. Our charter is physically visible in all of our locations, and the 4 themes that we have, so treating everybody with respect and dignity, creating a safe and respectful environment, hearing all voices, and then being curious to seek out and understand other cultures, is mirrored through all of our properties. Some of our enabling pieces of work to create an inclusive workplace have been to look at giving individuals more autonomy through their working flexibilities, like offering a 9-day fortnight, and then focusing on keeping people well through our well-being offering, which is now much more preventative and proactive through initiatives such as a funded health plan and online workshops. We've also had a look at our benefits package and looked to extend that out into being inclusive not only of our employees, but also offering services to the wider family of our colleagues. Things like our funded health plan is extended out to cover family members as a good example of that. And we've created an internal policy working group, which is very much horizon scanning. So supporting being more proactive and preventative, but looking at where societal changes are occurring and where guidance might be needed, along with reviewing the policies for employees with the consumer in mind to make sure that the terminology that we're using mirrors that concept of being inclusive and respectful, and is much more focused on being supportive terminology rather than thou shalt not rules. We operate a devolved model at Housing 21, which is to allow the autonomy to reflect the local understanding and needs in respect of the different operating models. And we're also striving to ensure that our employees are connected, particularly with the increase in remote working and that isolated courts where often individuals see their wider community as just being those individuals within that court model. So we're looking at how we can use technologies and digital connectivity and our self-service hubs to connect individuals through their social interests rather than their work interactions. So looking to connect them through hobbies and experiences rather than just letting their paths cross in the work capacity, which may not always happen. Our disability focus group aims to understand better the employee life cycle and identify where we can actually make improvements, such as a better onboarding experience or better engagement opportunities, or mirroring again, giving people a voice when they're in the organization. And this group gives people a very clear channel to do that, and is very much focused on that employee voice, but also focused on improvement and actions. So finally, our decision making and our prioritization is influenced by understanding data and trends, and we are progressing in terms of being a much more data-driven organization. We're a platinum Investors in People employer, and for the first time this year, we're one of a very small number of employers who are working in partnership with IIP, which involves them much more in our day-to-day decision making and activities through our internal working groups. And letting them help us influence on what best practice is out there that they're seeing through their standards. So we're moving away from an assessment process to one which is much more about collaborative working. And it seems to be working for us. We was named third on the Glassdoor Best Places to Work. We've had acknowledgement at leadership awards through our approaches to well-being, and very much around offering that flexibility. And as I say, we're very proud to not see our Investors in People platinum status as an assessment, but as an ongoing relationship, which is about maintaining the highest standards. We've got lots more to do as we head into 2024 in terms of how we want to make sure we really carry on embedding the respect and inclusion priorities. We're looking at our standards, and we're looking to review our accreditations based on not only having them for the sake of it, but also to make sure that the standards that we align to and the accreditations are ones that align to the best practices that are meaningful to us. We're looking at the challenges in terms of creating a diverse demographic to ensure that care roles mirror that, and to make sure that for those hard to reach areas, such as attracting more males to care roles or attracting younger individuals to care roles, that we've got proactive approaches to recruitment, which are much more about building relationships within those local communities in which our courts sit, to make sure that people understand what our business is about and the culture and value that comes from working at Housing 21. We're also progressing our data to make sure that we mirror the devolved model, and we can offer a much greater awareness for managers in their decision making through diversity dashboards, and looking at how we take our survey results out to understand how people feel into some of those managers and their decision making. So we're hopefully got a lot of really progressive activities going on in 2024, which are going to keep making sure that our agenda moves forward. So a very brief oversight there in terms of the employee side of our activities at Housing 21. And I'm now going to hand over to my colleague Tahir, who's going to talk through how we apply the same principles to our resident experience. Over to you, Tahir.
Thank you, Ian. I'm going to have to follow that now. So let's get sharing slides. Okay, hopefully you can see that. Yep, got the thumbs up. Good morning, everybody. It's an absolute pleasure to be speaking this morning, particularly on behalf of Housing 21, which I joined about 6-7 months ago, and it's been an amazing experience so far, working with the likes of Ian. And today I'll talk about embracing diversity for the benefit of residents. As you can imagine, with the timings, I will be talking in broad brushes, but I think within those slides you'll see some ideas and principles which I hope you can take away this morning. Okay, very quickly. I know that the people in this room already have an understanding of why diversity and inclusion is important, but it's always good to remind yourselves about why we are looking to embrace and advance equality and diversity. The principle of social justice and fair access to vital services is absolutely key. And we know that looking at demographics, that not only is there an increasing need and potential demand from diverse communities, particularly culturally diverse communities, we find that culturally diverse communities often age quicker than indigenous communities for lots of reasons which I won't go into. So there is a real untapped client group there that we do need to tap into. Of course, any diversity brings difference and vibrancy to our facilities, and we want to see that. That's a good thing, not only in having diversity in your workforce, but also in our courts, our extra care schemes, and retirement living. And it's good for business. Embrace diversity because it opens up to new markets. It's proven in numerous global studies that diversity in leadership roles is absolutely positively impactful on the bottom line. Well, it's the same as well when you're offering services to the general community. And also it's important to embrace diversity because you may already have a numerous diverse residents, whether that's sexual diversity, whether it's cultural diversity. We need to hear those voices, and often they are unheard. And one of the strategies we have is an easy to ignore strategy at Housing 21, where we're going to reach out to those communities that already live in our homes to understand what their experience is at Housing 21 and how can we meet their needs better. General broad brush principles which I would like to share is that whatever an organization does, it must be authentic, and it needs to be authentic to your organization's culture and values. There isn't a one size fits all in terms of how you embrace diversity and inclusion. There are some obviously core principles, but it needs to be in your organization style. You need to understand what the drivers are for your organization, because if you do understand why you're doing it, it comes across more authentic, and being authentic is absolutely essential when it comes to diversity and inclusion. Role modeling inclusive behaviors, particularly leaders. We need to see leaders talking about diversity inclusion as a positive thing, and you know, to role model to their teams, to their workforce, that inclusion and diversity are absolutely essential to the business and are of great value. We have to deal with bad behavior, making it clear what is unacceptable behavior, so that people who may be a little bit reluctant to consider housing and care, that, you know, if they were to be a resident, that we would take their safety, their well-being seriously. We would deal with any bad behavior, so that's important. Building local networks with trusted organizations, like the Bangla Association that's coming to speak after us. It's really important to understand organizations, particularly mainstream organizations. They are better off building networks with trusted organizations in minoritized communities in order to build those links. It's almost impossible to build them directly, and using a third party is often a really good idea. Deliver on your promises. Many minoritized communities are used to having promises that are not delivered. And therefore, you know, it's doubly important to, if you're going to promise to provide services or to support communities, that you do deliver on that, because reputation is everything. Word of mouth is really, really important. Listen and listen again. For the same reasons, it's important to listen and hear what people are actually saying, what they actually need, and not assume what people need. That, you know, needs are changing very rapidly, so we need to make sure we are listening all the time. Obviously, nobody likes tokenism. I just put at the end there, tokenism is not a good thing, but optics are important. And so use your marketing and your online presence to show a diverse face, and diverse images, and a feeling of welcoming to a wide variety of people, because that encourages people to approach you. So optics are exceptionally important in these issues. So a quick run through one of the projects we've got at Housing 21, which is our co-housing project, where we're developing in areas of in urban areas of deprivation with diverse populations. Our first co-housing project is in Lozells in Birmingham, working with the Bangladeshi community there. And it's very different to our normal offering, because we actually identify a project group and residents before the foundations are laid, and that's very unusual. It's turning things on its head, and the reason for that is we want to create communities that are and neighbours that are getting together from day one and have a say on the finished product from day one. And also, again, as I mentioned, working with local agencies as sort of connections, trusted agencies like we have done in Lozells, and local politicians is very important. And of course, the local authority essential as well. As I say, we identify potential residents at an early stage, and it does require a little bit of flexibility on the way we do things, such as relaxing the age criteria. And I did mention earlier that aging happens quicker in certain communities, and so that flexibility is required. Generally speaking, we are open to mix of tenures. As it happens at Lozells, we'll be looking at social rented, but maybe in future options we'll be offering shared ownership, for example. And in terms of the finished product, what will be the management arrangements? Well, there are a menu of options, and these will be discussed with residents until we settle on an option that is suitable for that new community. And it could be a TMO, it could be a managing agent, and it could be a number of other options as well. What we've learned is we need to do capacity building as well, because you know, a quick example is an architect's drawing means very little with quite a lot of the people we're working with, and why should it? And often it's easier to show people the potential finished product rather than talk about plans and so on. So there has been an element of that, and we're learning along the way. We're learning what works, what doesn't work. It hasn't been perfect, and you know, there's a lesson for us there that you have to keep going at it and be determined to deliver on the promises. So in summary, embracing and advancing diversity and inclusion, it's essential that employees feel included and respected if there's a chance to make residents feel the same. And that's the point that Ian was making. You've heard the phrase happy staff, you know, make happy customers. Well, it's the same principle. You can't achieve everything in a day, month, or a year. It's a journey which you must take step by step. You're eating an elephant piece by piece, and there will be lots of faltering steps. And the key is not to be put off the longer sort of aims and ambitions. And I, you know, Ian and I believe engagement is key to inclusion, whether it's people or residents. Keep talking, keep engaging, keep listening. And if they're not speaking, then it's probably the question that we're asking or the manner in which we're asking. So keep listening, and you'll be surprised what you might hear. And I will leave it there. If you want to know more, we're on the socials and our website. And obviously happy to answer any questions at the end of the session.
Well, Tahir and Ian, thank you very much for a really powerful opening slot. And Tahir, you mentioned the optics. I thought your slides with the images that you have, and Ian including that, was really, really sort of powerful in terms of visually sharing, as well as talking through sort of both your approach for people as well as residents, so for your workforce as well as residents. I'm sure we will ask people, please do post any questions into the Q&A box. I'm sure there are certain things we want to pull up, and I know for me there's several things that I want to sort of pick up on too. But you also talked about the co-housing project for the Bangladeshi community in Lozells. Now that's a good segue over to our next project. While there isn't necessarily co-housing, we do have an influential Bangla Housing Association in East London, and they are co-researching a number of issues. So I'm going to hand over to Manik and Bashir, who are going to follow on from your conversation and your to touch on some inclusive approaches that they're doing in this project, My Home, My Life.
Thank you, Jeremy, and thank you, Ian and Tahir, for starting us off. Good morning, everyone. I am Manik Gopinath. I'm the PI on the Amar Bari, Amar Jibon, My Home, My Life project. And I'm joined today by Bashiruddin, who is the CEO of Bangla Housing Association. It is a social housing association. And Bashir is one of the co-community partners and co-investigators on this project. So I am just going to bring up the slides now. Hopefully you can see that. Yeah, okay. Okay, so as you can see, the Amar Bari Amar Jibon is a Bangla phrase for My Home, My Life, and this is a 3-year Dunhill Medical Trust funded project. And you can see the co-partners here are colleagues from Bangla Housing Association, HousingLIN, and the Open University. Now, there are 2 aspects to this research. Given the persistent health and housing inequalities amongst the Bangladeshi community in the UK, the what is about listening to older adults, known as probin in Bangla, about the housing and housing-related concerns and needs. Majority of the Bangladeshi population lives in mainstream housing and in the social rented sector. But the focus of today's talk is on the how, the process of getting to this what. So we're using a co-produced approach to working with the communities, and I've just put up a small definition there to indicate in like a one line what is not a one-liner, as Tahish said, the kind of continuous work that needs to go into this kind of partnership. Right? So how are we working together? And just to say that whilst I just should have probably started off saying that while Housing 21 as an innovator spoke about how they are doing diversity and inclusion in their work with their residents and employees, this is about doing diversity and inclusion in the context of research. So just setting that out again. So how are we working together and how are we making sure we work together? So this journey started with PHA, HousingLIN, and the Open University coming together in 2021 at the bidding stage to actually bid for research money to carry out this project with the Bangladeshi community. And we were successful. In 2022, the funded research was launched. Now, I must emphasize that this is a new partnership. We did not know each other, so we are starting very, very fresh. And the working together for that 1 year before we even got the funding has enabled us to develop an engaged research design, a strong working relationship, and also ownership of the project. And 2022, as you can see, there are three people and communities or groups who have joined us on this journey. One of them is, of course, our postdoc researcher, Mahira Ruby. She might be in the audience today. She brings, along with her research expertise, she brings community engagement experience with her. And then we have an 8-member strong team called the Bangla Research Advisory Group. Now, this is a diverse community of men and women from the community itself, and they engage with us in all aspects of the project, and we'll just go further and see some of the work they do with us. We also have a paid consultancy of 8 community co-researchers who are carrying out the interviewing, the field work in the native language and dialects of Bengali and Sylheti with the community, with the probin. And one of my groups has disappeared from here. I don't know where. Sorry about that. We also have in 2023, we have appointed a group of transcribers to this research. Now, when we started this research, and it's good sometimes not to think of everything, there is not a lot of research infrastructure on the ground when you want to work with communities like this. And what I mean here is in-depth interviewing with 80 older adults in Bangla or Sylheti. So where does that resource come from? There are no transcribers who will transcribe in-depth interviews. And all of that resource we have created through this project. So we have now 8 people from the community again who are working on this, transcribing the in-depth interviews. And just to say that a lot of careful consideration has gone into thinking about the about paying attention to the diversity and inclusion aspects of these groups that we have on board, whether it's in terms of language or ages or sexes. So, and then finally, I think what we want to achieve is not just impact. As researchers, we are very much focused on impact. That's a requirement of our job. I think here we will use the word legacies. We do want to leave something important at the end of the work. And we hope by working this way, we will be able to do that. I must briefly mention that in 2023 and now in 2024, we are also setting up a community of practice of practitioners who are now going to help us shape the findings into some actionable policy and practice recommendations. And amongst the three co-partners, we sort of lead and support. So very broadly, Bangla Housing Association leads on the community side of things. OU leads on the research thing, where we have our expertises, and HousingLIN leads on the will lead on the community of practice sort of thing. But there is a lot of slippage between these roles as well. Okay. Right, this is just to show the people. As you can see, we are busy at work and we meet in a number of places. The core team usually meets online because that's comfortable, but otherwise we do meet in person. We must get a photo of our transcribers at some point in time. Okay, now I'm going to hand over to Bashir to talk a little bit more about their involvement with the project. Over to you, Bashir.
Thank you very much, Manik, and thank you, everyone. Thank you, HousingLIN, for giving us the opportunity to speak at this summit. It's great to be here. And on this slide, I'm going to talk about Bangla Housing Association, and as we are a community partner. Now, about Bangla Housing Association, we were established over 32 years ago to support Hackney Bangladeshi residents to meet their housing and welfare support needs. However, over the years, we have broadened our work to helping the people from the wider communities in Hackney, Islington, and Waltham Forest. Now, working for the community, as a registered social landlord, our main job is to manage housing and supporting our residents. We are also committed to support and improve lives of people in the community. Working in partnership with the NHS and other service providers, we are actively working, raising awareness about public health issues like heart disease, stroke, diabetes, and smoking. These are prevalent in the community. Before the pandemic, we hosted annual day trips and fun days for our residents and their families. We hosted annual 5-a-side football tournaments for our youths. Our welfare benefits advice and translation service for our residents and the community is very popular. Bangla COVID-19 Advice Project, funded by the National Lottery, or BCAP for short. During the pandemic, we set up this project, BCAP, to support the community through this unprecedented national health crisis. Through our network of contacts in the community and using varied resources, we reached out to the community with health messages and vaccine takeover programs in partnership with the NHS, City and Hackney Public Health Team, and the Hackney Volunteer Centre. Partnering with the Dorset Community Association in Bethnal Green, Tower Hamlets, we delivered food parcels to the elderly and those in need. BCAP work was appreciated by the community, and for this life-saving work, we received Hackney Mayor's Civic Award and a letter of acknowledgement from the Queen. Now, why you get involved with Amar Bari, Amar Jibon project? Well, Amar Bari, Amar Jibon, or AMAJ research is the most ambitious of all our projects that we got involved in so far. This research is looking into an issue most relevant to our work in finding out housing and neighborhood needs and aspirations of our Bangladeshi probin community. As a trusted community organization and with our knowledge and established network in the community, especially following our BCAP work, we can confidently reach out to the province and their families to engage with our researchers. It is also an opportunity for our staff team to learn about a major research project through its journey from inception to final reporting, while working with research academics, professionals from different backgrounds, and active community members. Next slide, please, Manik. Okay, thank you. DHS contributions to the Amar Bari Amar Jibon project so far. Well, we are very much involved in all decision making, including recruitment of the team members, like the postdoctoral researcher, the Bangla Research Advisory Group members from the community, and the province for the interviews, the co-researchers and the transcribers. And we are also heightening the visibility of the project in the community in the various ways that we're working with different organizations in the community and with our residents. And BHA is the focal space for coming together because the community knows us for so many years, and by being involved in this particular project, we are being seen as an organization at the forefront. We are also participating in the project team, the BRAG and co-researchers meetings in all stages of the project. We are participating in training for the co-researchers and providing space for the training at the Bangla Housing Association office. We are translating and creating communication materials, banners, posters, leaflets, letters, forms, and also we've also produced 2 videos. These were to recruit province from the community. They were in Bengali and Sylheti language. And here is a picture you can see of myself with a picture of a video. And the other picture is showing when we were doing training of the core researchers in our office. And we are also attending external meetings and seminars like this one to promote the project. Thank you. You're on mute.
Yeah, thank you, Bashir. Now, how does working together or working collaboratively, what does it do to the research? So far, we find that there are new insights from the ground, as we'd like to say, that is shaping the research. The original decision amongst the co-partnership was that we would go for 3 boroughs in London, Tower Hamlets, Newham, and Hackney, because Tower Hamlets followed by Newham has the largest population of older people from Bangladeshi community. But then when we had our PDRA and the BRAG community members joining in, conversations started, and they said, do you know that there is gentrification occurring from Tower Hamlets and Newham to Redbridge now? And so it was at the beginning, because the research was only taking off, we included Redbridge as another borough. So that is one way in how people bring their knowledge from within the community to actually shape the research. There are other examples as well, what we rather call tacit knowledges. You can't say what it is, but you just know instinctively what that is. And if you look at the poster here, it isn't the clearest version, but this is what the research team had mocked up. So we do a lot of mock-ups of everything, of posters, of questionnaires, of topic guides and everything. And then we take them to the meetings with BRAG members and with the BHA. And this is what we took, it looked perfectly all right to me and to all the academics. We all said yes to it. And then it was really taken through a process, and, it became this with some Bangla, with some phrases in Bangla, and there was a special emphasis on saying in the poster that, this is something you'll be doing for your community because people respond to that sense of community. So what we find is that it improves the quality of the research. It makes it culturally relevant and accessible. I must say we are on to like 60 out of the 80 interviews. So far, we have managed to gather people's responses. Now, there was also this conversation again, few examples, that we originally thought, and from what we have read and what we know, that there is a large Sylheti speaking Bangla population in the UK, which is right. But then we were informed that that is not so anymore. There is a sizable amount of Bangla speaking population also that comes from Bangladesh. And that has informed two things. One is, who are we recruiting, and making sure we recruit enough older adults who speak both the language, or dialects rather, I should say. But it has also informed our co-researchers recruitment, because they are the people who are going to be doing the interviewing. So it has made sure we recruit co-researchers, inform that strategy of having both Bangla speaking and Sylheti speaking co-researchers, amongst other things. And this is a small pie chart of, our incoming interviews, or rather the language representation of the probin who have so far taken part in the interviews. And as you can see, we have a sizable Sylheti speaking participants, but we also have Bengali and a few who have taken the interviews in English, sorry. Adding value, another thing it does is add value to the project. And ownership, I think. So this newspaper clipping is one of our co-researchers who is also a journalist in his day job. And he actually wrote up a small article around this and put it in the local newspapers to invite probin recruitment. So people run with things on their own. The video that Bashir was talking about in the last slide is something Bashir has come up with on his own, because there is no written Sylheti dialect. So all our written material that we are circulating to people to get involved in the research is in Bengali. So how do you talk in Sylheti? So hence the need for the video and getting there. Now, I must say I've done a head count of how many people are involved in this research. And if you leave out the 6-member core team, we have 23 community members to date involved in this research. That is a sizable community. And what it is doing, there's a nice give and take, because whilst these people who have little or very little or no encounter with research so far are learning something about academic research or about the older people in their community, at the same time, they're carrying the research, the progress of the research. And there are future networks. I mean, there's such an extension of networks, either professionals, but also people from the community. So it's our co-researchers who have sort of helped us find people who might be interested in transcribing work. So it's all very experimental, learning-oriented work. Okay, Bashir, over to you for that.
Thank you, Manik. Thank you. Right. What goes into supporting our various communities participate fully, meaningfully? Well, it's the openness to decisions being transformed through discussion and dialogue. We really encourage people at the meetings to speak openly and without any hesitation. There is no barrier, and that's what's making the discussions and dialogues very fruitful. And it's getting the communication right for accessibility, inclusivity, and this is something we heard earlier, and keeping everyone informed and up to date. Our communication practices with BLAG are constantly evolving. For instance, just to give you an example, we started off with sending out monthly newsletter, giving updates on the activities of the BLAG and the research itself. And then someone later suggested that maybe it's a bit too long to wait before you get the next update. So then we started off fortnightly WhatsApp voice, giving fortnightly WhatsApp voice updates. are really appreciated by the BRAG members. It's providing the flat spaces for open, candid, and constructive dialogue. We are providing training and ongoing support for co-researchers and transcribers. And the feedback that we are getting from co-researchers is really positive. These sort of training, once we have finished the project, something they're going to take away with them and use them in their future adventures. And it's about acknowledging and valuing what people bringing to the table. And obviously, people like that. And also it's about supporting and looking out for each other. So everybody sort of comes out when you are having a meeting, the fact that everybody is looking after each other and supporting each other and very positive, and the fact that everyone sort of feel that, I can remember somebody was saying that we feel that it's a family, and it's something that everybody is here to achieve something very amazing. So it's that sort of feeling that we have. I think we are ready for the next slide. Nick?
Do we have a few minutes to share the videos, may I ask?
Yes, please do. I think we'll do that, and then we'll move on to Teresa and Julie.
Okay. I must share the thingy. Share sound.
Thank you for giving me the opportunity. Thank you for housing.
Sorry, I just want to say these are a few voices, our community members' voices that we'd like to very quickly share with you.
About the needs and aspirations of the Bangladeshi.
Amar Bari, Amar Jibon housing research project run by Open University. I am proud to be part of this research team. This project is very close to my heart as it is about my own community, and it's something for the Bangladeshi community for the very first time. So far, I have conducted about 15 interviews. These conversations have shown me many different experiences and challenges related to housing and community life. Each interview has been like a different story in a book. Some stories made me sad, some made me happy, but most importantly, all of these stories gave me new insight about the housing, elderly life, different necessities, new ideas, and also problems to solve. I have visited many houses. Most importantly, for the first time in my life, I have visited sheltered accommodation and daycare centers. There were challenges and some unexpected problems I have experienced during my journey. For example, it was sometimes hard to arrange interview times with people, and there were technical issues. But these tough moments taught me important lessons about being flexible and persistent in approach. Through these interviews, I have learned more than just facts and figures. Each one of has given me a deeper understanding of what it means to be an elderly person.
Okay, second one.
Zakia, and I am delighted to have the opportunity working with the Amar Bari, Amar Jibon project and having to collaborate with some wonderful colleagues who have significantly contributed to my professional development and boosted my confidence. Engaging in this project has not only expanded my network but also deepened my empathy towards others, enriching my personal experiences. Contributing to community-centric work feels like a stroke of luck. One of the hurdles I encountered involved the reluctance of several provinces to share their financial data, despite my repeated assurances of confidentiality. Additionally, communication challenges arose with one or two probins whose speech was not very clear. Technical issues with my work phone further complicated matters, requiring me to overcome significant obstacles. However, the unwavering support and kindness of my team members, particularly Maharapa, Manik, Caroline, and Sheila, were instrumental in navigating these challenges. Thanks.
Probin community of East London. I regard myself as a young probin too. Pleased to be participating on the brags and feel honored to be able to express my views and
Manik, I'm afraid we can't hear this one. I'm
It's
going
very
to suggest we draw this one to a close.
okay. Thank you. Yes, I can always share it if later people want to hear. Thank you so much.
Thank you very much for your wonderful presentation. And what I loved about the final slide is you also had a picture of food, and you talked about the benefits and value of the group. I think food has played a prominent part
Yes,
as well, but that's another story. And
our community researchers are well fed, I must say, wherever they go for interviews.
I'm going to draw this one to a close, and we'd love to come back to it in the Q&A and discussion later, because I'm also conscious that we got some more video and material to show you from really another exciting project, the DemECH project. So Teresa and Julie, I'm going to hand over to you, and welcome aboard.
Thank you very much, Jeremy, and a big thank you to our previous speakers this morning. This has given us a great lead into the project that we've been involved in. So I'm Teresa Atkinson, and I'm a Senior Research Fellow with the Association for Dementia Studies, and we're based in Worcester. So looking at our project, yeah, we can have the next slide, Jerome, thank you. As you can tell, we haven't taken responsibility for the tech today. We've left that to the professionals. So this slide just really shows that, you know, extra care housing is a real option for older adults across the UK. And I think home is something that's essentially, it's one of the most important things in our lives. And I think for most of us, we can actually choose a time when we want to move, a location we want to move to, and for different reasons for moving. But I think as people age, these options become more and more restricted. And so I think it's very important that we find out more about extra care housing to see how that can support our older adult communities and really foster that inclusion, diversity and community that our session is all about today. So the Association for Dementia Studies has a long history of looking at extra care housing and doing research in that field. I've been with the association now for 12 years and been involved in different research projects. The first of those was ASSET, which some of you may be aware of, and this looked at how adult social care services were delivered and experienced in extra care housing. That was followed by ECHO, lovely acronyms, aren't they? So again, that was a more longitudinal project looking at how the changing needs of people living in extra care housing can be met. DemECH came on the back of this because what it really showed us was when we were looking around at different houses, different extra care housing schemes, what we really noticed was the real diversity there. So there are different ways of providing extra care housing. We looked at integrated, we looked at specialist, we looked at separated models, but we really wanted to find out more about how these worked for people living with dementia. So during this project, we saw the different impacts of how those different housing schemes worked, and we wanted to look at that in greater detail. Can I have the next slide, Jerome, please? So this was really timely because Jeremy's already alluded to this report, the all-party parliamentary group Housing for People with Dementia, Are We Ready? And that was a big question really that coincided with our research project and really came out around the same time. So we were very fortunate in getting funding for our project. It was an 18-month project, and during that time we looked at 9, it was originally 9, but then we had to reduce that to 8 different models, and I'll explain that in a moment. So we looked at 8 different sites across that time, and what we really wanted to find out is how people with dementia were being supported in extra care housing. If I could have the next slide, Jerome, as well, please. So, as I said, this coincided really well with the APPG report, because that really said that actually there are different ways of delivering interventions, and housing itself is an intervention it's not really well researched in the UK as an intervention. So we really wanted to dive a lot deeper into that and see how different models could support people living with dementia. So I mentioned that we did start out with the idea of 9, and that's because we wanted to look at 3 models of separated. So that's where people with dementia are living in a separate part of the building from other people. We wanted to look at 3 models of integrated, which is the most common, which is where people with dementia live alongside people without dementia, without any other health conditions, or sometimes with differing health conditions. So that's a real diverse and mixed community. And we also wanted to look at specialist. So this is where people living with dementia are all in one group together. And they use a phrase that says, oh, we're all in the same boat, so we all get along. But it's interesting, really, that what we found was that there is still a lot of stigma. So although that seems a very inclusive model, people with dementia are all living together, they're all in the same boat, actually there's still a lot of stigma within that group. So we found some real challenges and benefits, and that was the main thing that we wanted to explore for people. But we also wanted to look at the factors that impact upon those benefits and challenges, and really see how there can be advantages and different disadvantages and advantages for those 3 different models. Interestingly, the separated model was interesting in terms of its inclusive approach, because although people living with dementia lived in a separate part of the building, there was doors through into the integrated, and we saw a lot of really good practice in that model, where people with dementia were coming along to, for example, the knit and natter that I took part in, and everyone was getting along really well. So even though you can have a separated model, and the reason we only had 8 instead of 9 was that we couldn't find 3 examples of a separated model. So it's really interesting, isn't it, how things fall out of favour, but actually when you talk to the people living in those schemes, that works really well for them. So I think we have to listen to all of those voices, and inclusion was a part of this today. And what really strikes me is that we hadn't heard until this point the voice of people living with dementia in extra care housing. So the project really tried to put that at the forefront, that what we really tried to do was find out from the people themselves what works from them. We also spoke to commissioners, and we also spoke to housing providers and managers, extra care, care managers, for example, and care workers. So we really wanted to include everybody's voices in that, but we really wanted to promote the people living with dementia. And as part of that inclusive model, Monique beautifully referred to how we can co-produce that research, and we had a brilliant steering group, and included in that steering group were 2 people living with dementia, living in extra care housing, and they were one of our sites, and they were supported by a lovely lady who was their staff development and community development worker. So she supported those people to be involved right throughout that project, through the stages of developing the interview schedules, through looking at the data, and finally looking at the resources that we produced. So they were really key to our research. So it's not only the sites that need to be inclusive and how we choose those, but it's also the model of that research. And as Monique and Bashir have referred to earlier with their project, really bringing those voices into the projects that we develop. Could I have the next slide, please? This is our wonderful launch. We were so privileged to be able to launch the resources that we produced, and we have produced more since, as you will hear from Julie shortly. At this point, which was March last year, almost exactly a year ago, I can't believe how time flies, we launched our booklets. So these were produced. The large one there that you can see in blue is the booklet for people living with dementia. There's a booklet for commissioners and a booklet for housing housing providers. And these were really important to us because we don't just want to do research articles or reports that go back to funders or sit on a shelf somewhere. We want to get those messages out to the people living with dementia so that they're privileged then to make those choices about where they live, to find out what the advantages and disadvantages of extra care housing are for them, and to really scope out that before they move there, to find out what they need and look in their local community. Just as you and I would be looking for a house, we would look to find a suitable location, and that should be a privilege for older people as well. So we were beautifully hosted by Lord Best, you can see there on the left-hand side, and the experts by experience that we included on our steering group. You can see in that middle slide there, Donna on the left is the supporter, and then we've got Christine, and we've got Bill and myself and the researchers in the background there. So we were really privileged to be able to launch our resources there. And as Monique said, you know, what we need to leave with our projects is a legacy. It's no point just having something that we do, we find out, and it doesn't go into practice and it doesn't have an impact. So that beautifully leads on to my colleague Julie, who will tell you about our legacy and about the other resources that we've been able to make and develop from this project. Over to you, Julie.
Okay. Thank you, Teresa. Could we have the next slide? Yes, thank you. Hello, my name is Julie Barrett, and I'm a research fellow with the Association for Dementia Studies at the University of Worcester, and I'm also the research coordinator for the Housing and Dementia Research Consortium. And I'm going to tell you about the outputs or the resources that resulted from the DemECH project. Next slide, please. Okay, so Teresa's already mentioned the booklet, so I won't go into those. Following the completion of the DemECH project, we were successful in obtaining extra funding from the NIHR School for Social Care Research in the form of an added value award, which we used for additional dissemination and impact activities, which were an infographic summarising the key insights, 3 videos aimed at the 3 different stakeholder groups to match the booklets, and an impact evaluation survey to gather the data on the impact and utilisation of these resources. All of the resources, that's the booklets, infographic and videos, have been disseminated and publicised earlier this month. The DemECH project started out asking, how can extra care housing support people to live well with dementia? And hopefully these resources show how. Next slide, please. That's just the front covers of the booklets. So next slide. Right. So the infographic presents a quick and easy to understand summary of the DemECH key findings and recommendations. I feel like I'd like to give people time to look at the infographic because I think that the artist did a really good job here, but it looks so small. So instead, can I encourage you to visit the DemECH resources webpage where you can view and download all of the resources, and there should be a link provided to this webpage in the chat box. Next slide, please. The 3 videos were designed to support and supplement the 3 key insight booklets and deliver the key messages in a more powerful and memorable way by featuring the voices of residents living with dementia, family carers, and extra care housing staff. To make the videos, we filmed the researchers talking about the project findings, the project to them, and we returned to the original case study sites that Teresa spoke about to film residents living with dementia, their family members and extra care housing staff. We aimed to film the original project participants talking about their experiences, but this was not always possible. The videos are around 15 minutes long each, and each one is slightly different, being targeted towards the different audiences. We will show a clip of the videos after the slides. Next slide, please. Right, the final added value activity is an impact evaluation survey with which we will explore how people living, sorry, my doorbell, with which we will explore how people have used or intend to use the different resources, ease of access to the resources, what they think of them, how useful they have found them, and how the resources have helped or change their approach to supporting people living with dementia in extra care housing. We will be sending out the link to the survey around mid-March, so I can't report on the survey yet because we haven't sent that out yet. So we will send that out to our various networks and promote via a blog and social media. Next slide, please. Okay, so the link to the page containing all the resources you can see there, but just a reminder that the link should be posted in the chat box. And now we're going to show a clip from the video that's targeted at housing providers.
So having your own home is really important to every one of us. And the real joy, I guess, of extra care housing is that you have got your own front door. It's your private space. You can entertain friends there, you can have your family round.
And I went to stay with my daughter. Well, they got this up to standard with furniture and everything for me, and made it how I would like it.
A lot of older people future-proof and move into extra care housing quite early so they can make new friendships, maintain their community links, for example. And I think it's really important for people living with dementia that they think of those things at the point of diagnosis, because moving in at the point you are still able to make those friendships, get used to the staff get used to you, familiarise yourself, orientate yourself around the building. Actually, as symptoms progress, it becomes easier to live in extra care housing because you're already familiar with that design.
And I think the most important thing is choosing the right time to move into a complex like this. And that is where I think we definitely chose the right time. Because when you think it's the right time, oh, we're not ready for it yet, so we'll wait for it. That's wrong. Because when you wait for it and you think you are ready for it, quite possibly it's too late.
The person living with dementia might need more support than can be offered by the scheme itself. So actually still having those connections with your friends and family, for example, family coming in to do the shopping, take mum out for Sunday lunch, do some visits to the park, those connections are still really important.
One of the big benefits of extra care housing is that there can be social opportunities available on site. These might be formal arranged activities that are put on by staff or external providers, but they can also be the kind of informal opportunities to meet your neighbours, get to know other residents. And the restaurants and cafes and schemes can be a real kind of hub for where new friendships start.
Yeah, I've seen a change in him. He joins in a lot of things that he never used to. He actually, there was a come dancing the other week, I've never seen him dance before. He dances now. As I say, there's always activities, always something going on.
As symptoms advance, sometimes actually you'll need more support from staff on site to perhaps remind you when activities are happening or even support you to take part. But that's only available if the staff are available.
I think there comes a point when extra care decide that this probably isn't the correct environment.
That's the beauty of this place, where they can still live their life to the full for as long as possible, but there may come a time when they can't.
Developing positive relationships between the staff and resident is crucial to care. And actually what we found was that often where you had specialist staff who had specialist training in dementia, this is what worked really well. They had a much better understanding of dementia, and they were actually also more committed to finding ways to support people to live in place, even when their symptoms were changing. And that can be really important to help somebody live in place for longer.
You can live well with dementia if you have the right support. And that's what's really important. So, you know, I know first-hand experience for myself of moving someone here and what it can do to benefit their lives.
Well, she's just there, and if you've got a problem or you want just a bit of reassurance, you know, she's there and she'll just sit down, talk to us, have a cup of tea.
Okay, so you can see that, like the booklets, the video summarise the benefits, challenges, and what helps for people living with dementia and extra care housing. And we kind of integrated bits of the infographic in to introduce the different areas there. And the booklet for adult social care commissioners and professionals and the booklet for housing providers also describe the pros and cons of the different models of extra care housing that Teresa was talking about. So, yeah. Thank you. I'll hand you back to Jeremy now.
Well, Julie, Drew, thank you very much. Really informative presentation, and I know, having watched 40 minutes of a video, you've managed to condense the hard work you've done to condense it into a short extract for the benefits of us this afternoon. That was really brilliant. Well, look, I'm going to invite everybody to join us now, and we've got a couple of questions in the Q&A box, I think. I'm just going to have a look at those, and also I've got some other ones as well. I want to kick off, though, by picking up a thread, I think, in my view, that appears right from when Ian opened right through to the work of Amar Bari and DemECH. And this one is around sort of the culture, both in terms of the people as workforce, but I want to start off by thinking about governance and leadership. Because I was just wondering, from a Housing 21 perspective, you talk very much about sort of engaging and involving, you know, as part of an inclusive approach. How is that reflected in your governance as well? Because I think what I got from both the Amar Bari and from DemECH is that, you know, very strong advisory boards, you know, and I think Bashir, we have the mayor of Tower Hamlets, you know, who's a member of the Bangladeshi community as well, you know. So, any thoughts around leadership?
Shall I take that, Ian? Yeah.
Yeah, you go to him.
Yeah, just again a matter of principle that you are, you know, you're up against it unless your governance is absolutely committed to diversity and inclusion, and actually is pushing for it and role modeling it as well. It's absolutely essential. You're going to push water uphill otherwise. It has to come from the top. It has to come from board members. It has to come from leadership, which is why I talked about role modeling inclusive behaviors. And, you know, whether it's equality impacts on board papers, whether it's making sure that there is, you know, scrutiny for the progress you're making on lots of ambitious plans. You know, it's really essential that board members and leadership are constantly pushing the agenda and pushing the envelope as well, because that's where the drive really comes from. So for any organization, I would always say, make sure your governance is diverse if you really want to achieve big things.
Yeah, and I think just adding to that as well, Jeremy, I think it's about ensuring that, you know, for us, the word embedding is what this is all about. It's when you've got a board that look with a lens naturally of looking at practices that are coming to them, of saying, well, you know, is that practice being done with an inclusive lens put on it? So I think for us, it's all about, you know, trying to stop respect and inclusion being seen as a separate agenda, but having it one which is just embedded in the activities of the whole organization, rather than it feels like it's us taking out a practice to the business. It's the fact that it's just culturally embedded, that we think with a lens on it of, well, what impact could that have in terms of on the inclusion agenda? So, you know, as Tahir says, we very much embed equality impact assessments. I think our measure is when we don't actually have to do that as much, because people naturally thinking about a piece of work from an inclusive angle.
Yeah, no, I like that. Manik, Bashir, Teresa, Julie, anything you've thoughts about leadership and the cultural changes there, or the challenges even?
Can I come in?
Please,
I think
yeah.
I agree with Ian and Tahir there. It's leading from the front and the back by doing, what you show. The values are caught, values are not taught, and these are values, I think, more than principles. And so having that always in your mind. But the challenge of that is, as we find in research, is that is why when we talk about co-produced work or collaborative work, and I think Tahir and Ian used the word authentic, you used, isn't it? And we have often used the word, we now start using genuine, is that, it is the practice. It is easy to set up boards and all of that, but the doing of the work, always keeping that in the whole priority list of things, along with all the pressures, is something which you really need to consciously work on every time, all the time.
Yeah. And any thoughts from Teresa or Julie around that sort of?
Yeah, I'd like to come in there, Jeremy. Thank you. And thank you, Monique, because that's absolutely spot on, I think, from a researcher perspective. We tried very hard when we were looking for our 9 and then 8 case study sites to actually get a really diverse and inclusive population. But, sometimes it just doesn't happen, and you have to really try and rise to that challenge, I think. It's very difficult when you're approaching, as a researcher, when you're approaching, if you like, the gatekeepers of those sites, and you're asking if they would like to be involved. Sometimes you are just hammering on a closed door, and you have to try and find different ways of opening those doors, I think, and making sure you really hear all of those voices. And we realised that's a limitation of our DemECH studies, that we didn't reach all those voices. It was mainly, a white British population, and that's something we need to try harder for. And I think, we should hold our hands up and say, that study was limited in that sense, really, because we can go further then, can't we? We know what we need to do next, if you like. It's our next steps.
Yeah. And this leads quite easily on to Abdul's question, I think, because, what he's really challenging us to think about is, how do we shift that dial? And if you see his question, he's talking about, the dial of awareness from, of research to culturally acceptable provision. And it feels to me that sort of builds on some of the Housing 21 stuff that Ian and Tahir just shared with us. But what I think Abdul's thinking is about, how do we mainstream this, both in terms of mainstream housing as well as specialist housing? And he's interested in our views on that. So Tahir, Ian, do you want to kick off?
I think I mentioned it in my presentation that you've got to be brave, you've got to try new ideas, you've got to work with trusted agencies, and then you've got to find what lessons you've learned and then try to mainstream those. And, there isn't a silver bullet, but we can learn a lot from what was a burgeoning ethnic minority housing sector movement, in the housing sector, which was very close to its clientele, and I think that's the lesson. It's finding ways to be close to minoritized communities and be able to listen and take on board views. But it does require a lot of testing, and it requires possibly making mistakes, but to constantly be moving on. And so in my view, the co-housing project is a good example of trying something different. And what we're doing is actually recording all the lessons we're learning, some of the do's and don'ts. And the idea is long-term, Jeremy, it is, well, how can we mainstream this? How can we make this standard in Housing 21? That is the long-term aim.
Yeah. And I think, just add into that, Jeremy, just in terms of some of the academic research, I spent many years working at a university, and I'm very aware of, the impact that academic research can have. But I think sometimes there's a gap to bridge as to how that academic research turns into practical activities in organisations like Housing 21. And this is why events like this that give a forum to that academic research, the credible academic research, and how we can turn that into practical actions and learn from it, needs to take place, because there's always a lot of, what I'd call almost that commercial hearsay noise about what a good employer should be doing. And unfortunately, sometimes it's not underpinned by the academic thought process of what is actually needed. So I think, how we bridge that gap and how we bring attention, just to your question earlier to the board members, is we need to make sure that academic research feeds into our organisations and our activities to inform them, and not just sometimes the noise that we hear about what good employers are doing. So, one of our principles is to underpin everything with education, and some of that education is, the academic research to sit behind why things are how they are.
Ian, I'm conscious we lost a little bit of that. I just think it just may be the headphone connection, but I got what you're saying, and I think it's really important that we look at that, how we research into practice, and that's why it's sort of the funding that Dunhill have done for the Amar Bari project, the NIHR have done, is there's a real requirement about looking at the impactfulness of that, not just in terms for the research community, but the beneficiaries of that research as well. So again, that's a really critical thing. Bashir, did you want to come to that?
It's the diversity and inclusivity is so important for us at the Amar Bari project. When we recruited the Bangladesh Research Advisory Group members from the community, we deliberately went about to find people from different backgrounds. Like we've got in this group, we've got 70-year-old, and we've got 30-year-old, and then we've got men and women and people who can speak English. We've got a couple of ladies in the group who doesn't speak English so well, but we provide language support, when we at the meeting. So we wanted to make sure that the group was as diverse as possible, and everybody had an input, and everybody were given an opportunity to raise their voice and speak in these forums. So it is really important for us, the diversity and inclusivity.
No, thank you for that. And also on a personal note, can I thank your team, both at the OU, but also the various partners and the staff who have all joined this call to listen in. So it's lovely to be part of that community as well. And I think that's another thing that Teresa and Julie have really felt the value of that participatory involvement right from the outset of everybody who's involved in the DemECH project too. And I think hats off to Dunhill and others for helping build that capacity as well. Yeah, that's just personal note. Julie, you talked about the research consortia. Do you see this and other projects like the Dementia and Housing Working Group as a way forward to support? And again, I know Vanessa at Housing 21 is an active partner in that. Did you see this as a way forward in both, not just dementia, but we also need to support other groups, sort of issues around, sort of the work that Tahir and others are doing, and Abdul indeed, around Black and brown communities as well?
Yes, certainly. Yes, hopefully we can, like Teresa said, we hands up. The DemECH project was really not as inclusive as we'd liked it to be, but it is very difficult for us to find to get access to the other communities. So yeah, and Jeremy, you raised an important point about impact, and I just wanted to say that we've already heard anecdotally from the housing providers that they are using our resources in their staff training, so that's really good. So watch this space for the results of the impact evaluation surveys. So it's, like you're saying, it's really important for us to understand how these are being used, and if they're actually getting out there to the organisations, like Ian was saying. Any advice you have as well, Ian, on how we can get these resources that we've developed, get them out there and get them used.
That's great. And I know the LIN will continue to champion and promote. And, I think Tina was with us earlier, who's done a lot of work in the background, both for Housing 21, but prior to that, at Stonewall, we want to be much more inclusive and also to encourage the regulators, the investors to think this as well mainstream, just picking up on Abdul's point. And that builds on some work that the LIN has done in Kirklees as well, just to demonstrate some of the real issues around, in that case, the South Asian community in terms of their access to housing, both mainstream and specialist. So I think these are all issues that we've touched on, and what you've all demonstrated this morning really is a rich diversity of approaches, both in terms of co-production and co-creating right from the outset with local communities. So whether it's the co-housing scheme or the sort of the investors in people equivalent, that Ian talked about, these are really important milestones and demonstrate how the sector is taking this forward. We've got a couple of final minutes. I'm just going to go around the virtual table to see if there are any final comments. I'm going to start off with Bashir. Bashir, any final thoughts and comments from you?
Obviously, again, thank you very much for giving us the opportunity to come and speak. The project we are involved in is a fantastic project. As a community organization, my staff, and we are really very much learning every day through from this project, because we are involved with the academics, professionals, community members. So we are, it's a learning process for us. And attending this morning's session again, especially the dementia, it's really, all the things that I've heard is really inspiring, and a lot of things to take away. And obviously, inclusive diversity, or Sahir and Ian talked about, again, is something very much something to learn and take away from this morning's session.
Brilliant. Teresa, Julie, or Manek, I'll finish with Ian and Tahir and Ian. Any final comments?
I'd just like to say, to echo really what Bashir's just said, this is such a valuable opportunity, not only for us to disseminate, the wonderful work we're all doing around the virtual table, but actually to make new connections. And, just picking up on what Bashir said, thinking about how we could support people with dementia in Bangladeshi communities, this would be really great inspirational work to do. So thank you for all the new ideas, everybody.
And just adding to that, Teresa, you'll have a very discerning research partner in BHA next time, if you do work with that.
Thank you.
Yeah. So I'd like to say thank you. I echo what people have already said, but I think these platforms are important, and reacting to Abdul's question is about also awareness raising and putting in some sparks, hopefully, about how things could look. So if anything, people take away, even if they remember it for some time. That's great. Thank you.
Well, look, I'm going to ask Julie to say a couple of words and then move on.
Okay. Yeah, I was just going to say thank you to Housing 21 and the Housing LIN for their involvement in the DemECH project, and also featuring in our videos. You'll see Jeremy features a fair bit. So, yeah.
Well, I'm glad you didn't show that this morning. So, yeah.
Okay.
Yeah.
Thanks.
Well, look, on behalf of us all, can I thank you all? And I'm going to give final words to Ian and Tahir, the sponsors of this session, and I'll draw it to a close after that. So, Ian and Tahir.
Ian, do you want to go first?
Yeah, so I think in terms of looking forward, and this is where we want to be as Housing 21 as progressive. I think there's many exciting things on the horizon. I'm particularly interested in looking at how digital capabilities and technologies can advance the respect and inclusion agenda within workplaces through the connectivity side of it. But a great thank you to for the opportunity for us to give a platform for our work at Housing 21, but also, more significantly to our colleagues out there doing this academic research that will shape our practices in workplaces going forward. It's fantastic work. We need to make sure it's always heard.
Yeah, I just wanted to say thank you for inviting us. It's been a pleasure to be part of this session. It's obvious that there's a great will in the sector to advance equality, diversity and inclusion. And the message I would leave is be brave, try new things. And if you're not sure, ask one of the many, many, many fantastic local community-based organizations around the country. They will know.
Yeah, no, that's a really good point and echoes some of the points that you and Ian are making in your opening slides. Well, look, can I thank everybody for a fantastic session? I thank Housing 21, as I said, for sponsoring the summit and this particular session. It's worked fabulously, and I think I've enriched my life learning more, and I've been heavily involved with a number of your projects over the last few years. I just want to sort of conclude by thanking all the speakers. Thanks very much for your time and preparation. We look forward to continuing this journey with you. Can I also thank the team behind the scenes? You see Jerome and Sally on screen, but there's also Alice behind the scenes as well. And if you want to be involved with the LIN, we have one final slide which shares with you what we do. Do let us know if you want to speak at a future event, or when you complete your survey shortly, and any feedback. If there are items that you'd like to think that are missing and would like us to address in future. If you also want to be more involved as a sponsor of the LIN, or involved in engaging with us in other ways, please let us know, and you have the info at housinglin.org.uk email address here. Ian, you mentioned stuff about technology. I couldn't have said it more succinctly. Please do join us this afternoon for another session, which is going to look a bit more detail about co-production and technology, led by the TAPI project and technology for our ageing population. And we'll be joined by the Chief Exec of the Dunghill Medical Trust, who will be chairing that session at 2:30. If you haven't signed up, there's still time for you to do so. But for now, we very much look forward to seeing you at another event. And the recording, the slides and the transcript of today's session will be made available by the team as soon as they can. So thanks very much, and hope to see you soon. Bye, everybody.